Are your swollen feet, constant fatigue, brain fog, or unexplained mood swings silently warning you about your blood pressure medication? You may think it's aging or stress, but it could be something far more dangerous. Amlodipine, one of the most commonly prescribed drugs in the world, is quietly linked to a range of side effects, some mild, others deeply alarming. What's worse? 1 in 8 users experience serious reactions, yet most are never reported or recognized as drug-related. In this video, we reveal the 12 most dangerous side effects of amlodipine, including rare but life-threatening reactions that could be happening in your body right now. Don't ignore what your body is trying to tell you. This video is for educational purposes only. Never stop taking any medication without your doctor's guidance. Number 1. Paradoxical cardiovascular effects of amlodipine. Amlodipine is widely prescribed to lower blood pressure and prevent cardiovascular events. But for some patients, especially the elderly and those with underlying heart disease, this medication can paradoxically worsen the very problems it aims to prevent. These are called paradoxical cardiovascular effects, and they can be dangerous, even life-threatening. One of the most serious complications is coronary steal syndrome. This occurs when amlodipine dilates healthy coronary arteries more than diseased ones. The result? Blood is diverted away from areas of the heart already struggling with poor circulation. Instead of relief, the patient may experience worsening chest pain or even suffer a heart attack, especially during the early stages of treatment or when the dose is increased. Next, we must consider arrhythmias. Amlodipine can trigger abnormal heart rhythms. Some patients develop bradycardia, where the heart rate slows dangerously. Others may develop tachycardia, where the heart races uncontrollably. Both conditions disrupt normal cardiac output and may require emergency intervention. Then there's hypotension, or a sudden drop in blood pressure. While the goal is to lower blood pressure, amlodipine can sometimes lower it too much, too fast. This may cause dizziness, lightheadedness, fainting, and serious falls, especially in seniors. In severe cases, vital organs like the brain and kidneys may receive inadequate blood supply, putting the patient at risk of shock or long-term damage. In response to dangerously low blood pressure, the body may trigger reflex tachycardia, a compensatory mechanism where the heart races to maintain circulation. Ironically, this increases the heart's workload and oxygen demand, which can further stress the cardiovascular system. If you or someone you love is taking amlodipine and experiences chest pain, heart palpitations, extreme fatigue, or fainting, seek medical help immediately. These symptoms are not normal side effects. They are red flags that demand urgent attention. Number 2. Dysgeusia, the hidden impact of amlodipine on taste. Amlodipine is known for managing high blood pressure, but few are aware of its disturbing effect on one of our most vital senses, taste. This side effect, known as dysgeusia, may seem minor on the surface, but its impact on daily life and long-term health can be profound. Patients report sudden changes in the way food tastes, a persistent metallic, bitter, or foul flavor that distorts every bite. In more severe cases, people experience ageusia, a complete loss of taste. Foods that once brought comfort and pleasure now seem dull, unpleasant, or even repulsive. This isn't just frustrating, it's dangerous. When taste is altered or absent, appetite often declines. Over time, this can result in unintentional weight loss, malnutrition, and nutritional deficiencies, especially in older adults. People may skip meals, avoid fruits and vegetables, or rely on highly processed, salty foods simply for texture, putting them at even greater cardiovascular risk. There's also a safety concern. Without taste, you may not detect spoiled food, increasing the risk of foodborne illnesses and poisoning, especially in those with already compromised immune systems. Beyond the physical consequences, the emotional toll is real. Taste is deeply tied to memory, joy, and social connection. Its absence can contribute to depression, social withdrawal, and loss of interest in eating or gathering with loved ones. For seniors or those already battling illness, this can accelerate physical and emotional decline. The exact mechanism behind amlodipine-induced taste disturbances isn't fully understood, but is believed to involve interference with calcium channels in the taste receptor cells. If you notice changes in your sense of taste after starting amlodipine, don't ignore it. Speak to your doctor immediately. This seemingly small symptom may be signaling a deeper problem, and it deserves to be taken seriously. Number 3. Gingival hyperplasia, the silent oral side effect of amlodipine. Amlodipine is prescribed for millions to control high blood pressure, but few are warned about its hidden effect on oral health, gingival hyperplasia, or abnormal gum overgrowth. While often overlooked, this side effect can lead to serious functional and cosmetic complications if not addressed early. Gingival hyperplasia typically begins within the first 3 months of starting amlodipine. The gums slowly become thicker, more fibrous, and enlarged, especially around the front teeth and areas where plaque tends to accumulate. In time, this tissue can grow to cover parts of the teeth, making chewing, speaking, and even closing the mouth more difficult. The overgrowth is not only uncomfortable, it interferes with proper brushing and flossing, increasing the risk of cavities, gum infections, and periodontal disease. What starts as a minor cosmetic concern can quickly progress into a major dental issue requiring surgical intervention. Research shows males are at greater risk, as are patients with poor dental hygiene or pre-existing gum conditions. Even with regular brushing, amlodipine alters the way gum tissue behaves. It interferes with collagen metabolism, the protein structure that supports healthy gum tissue, leading to excessive buildup of fibrous tissue. Unlike common gum swelling from inflammation, this is not reversible with basic cleaning. Overgrown gum tissue becomes dense, fibrotic, and resistant to standard treatment, sometimes requiring periodontal surgery to restore normal function and appearance. The good news is, gingival hyperplasia can be prevented or minimized with strict oral hygiene, regular dental checkups, and early intervention. If you're taking amlodipine and notice changes in your gums, thickening, puffiness, or bleeding, don't ignore it. Inform both your dentist and physician. It's not just about your smile. It's a signal your medication may be affecting your body in unexpected ways. Number 4. Severe psychological changes. The overlooked mental side effects of amlodipine. When people think of side effects from blood pressure medication like amlodipine, they often focus on the physical swelling, dizziness, or fatigue. But what's often missed and dangerously underestimated are the severe psychological changes this drug can trigger in some individuals. Patients have reported sudden episodes of overwhelming anxiety, tightness in the chest, racing heartbeat, and an irrational sense of impending doom. These panic attacks often appear without warning, leaving patients confused and afraid, especially those who've never experienced anxiety before. Even more troubling is the onset of depression. Amlodipine can cause a deep and persistent sadness, a loss of interest in once enjoyed activities, feelings of hopelessness, and even suicidal thoughts. Insomnia, nightmares, or waking up throughout the night are common, creating a vicious cycle where lack of sleep worsens emotional instability. In many cases, patients also suffer from intense mood swings, sudden irritability, unexplained anger, or even noticeable personality changes. Loved ones often describe the person as not themselves. This can strain relationships, disrupt work life, and create social withdrawal. What makes this even more dangerous is that these symptoms are frequently misdiagnosed as primary psychiatric disorders. Many patients are wrongly prescribed antidepressants or anti-anxiety medications when the root cause, amlodipine itself, goes unrecognized. The brain is sensitive to changes in calcium signaling, which amlodipine alters by design. This can interfere with neurotransmitter balance, emotional regulation, and stress response, especially in individuals with the history of mood disorders or neurological sensitivity. If you or someone you care for has started amlodipine and suddenly struggles with mental health symptoms, don't dismiss it as a coincidence. Talk to your doctor immediately. This is not just a matter of mood, it's a potential medication side effect that requires urgent medical attention. Number 5. Skin reactions and rashes. Amlodipine's alarming dermatological risks. Amlodipine is often trusted for its role in managing high blood pressure, but what many patients aren't told is that this drug can trigger serious skin reactions, ranging from mild irritation to life-threatening dermatological emergencies. One of the most common skin-related side effects is a maculopapular rash, a widespread reaction that appears as flat red patches, often combined with small raised bumps. It typically affects the trunk, arms, and legs, and may be accompanied by itching, burning, or tenderness. While not always dangerous, it's often dismissed as an allergy or unrelated irritation. But the danger escalates with rarer conditions like Stevens-Johnson syndrome, SJS, and toxic epidermal necrolysis, TEN. These are medical emergencies. They can begin with flu-like symptoms, fever, sore throat, fatigue, and quickly progress to blistering, peeling skin, mucosal erosion, and widespread damage to the body's protective barrier. Timing is unpredictable. Reactions can occur within hours of starting amlodipine or take weeks to appear, making the connection easy to miss. Once SJS or TEN begins, it can rapidly deteriorate into multi-organ failure, sepsis, and death if not treated immediately in a hospital setting. What's happening beneath the surface is an intense immune system response where the body mistakenly attacks its own skin cells. This may be triggered by hypersensitivity to the drug or an inflammatory cascade involving T cells and cytokines. The emergency signs to watch for include sudden skin pain, blistering, detachment of the skin, sores inside the mouth, and persistent fever. If you develop a new rash after starting amlodipine, or if an existing rash begins to worsen, do not wait. Seek medical attention immediately. When it comes to drug-induced skin reactions, early recognition can mean the difference between a full recovery and irreversible damage, or worse. Number 6. Flushing. Amlodipine's visible but often misunderstood side effect. One of the more visible yet commonly overlooked side effects of amlodipine is flushing, a sudden, often intense sensation of warmth, redness, and heat, especially in the face, neck, and upper chest. While this reaction may appear harmless, it can be unsettling, particularly for those who aren't prepared for it. The cause lies in amlodipine's primary mechanism of action, calcium channel blockade. By relaxing smooth muscle in the blood vessel walls, the drug causes vasodilation or widening of the vessels. This increases blood flow near the skin surface, resulting in that characteristic red, flushed appearance and noticeable warmth. Flushing can occur minutes to hours after taking the medication, often without any warning. It may last just a few minutes or extend for over an hour, depending on individual sensitivity and dosage. In some patients, especially early in treatment, it may happen frequently. In others, it may disappear altogether as the body gradually adjusts. For most, flushing is medically harmless, but its social and emotional impact should not be ignored. Sudden facial redness can be embarrassing, especially in professional or public settings, and may lead to self-consciousness, avoidance behaviors, or stress, ironically further exacerbating the symptom. In rare cases, flushing may be misunderstood as an allergic reaction, particularly when accompanied by sweating or palpitations. However, unlike more dangerous conditions like angioedema or rash, flushing typically does not involve swelling, hives, or breathing difficulty. If you experience this side effect, do not panic, but do monitor its frequency and intensity. While it may fade over time, persistent or severe episodes should be discussed with your doctor, especially if they interfere with your quality of life or indicate potential blood pressure instability. What's visible on the surface might be a clue to deeper vascular sensitivity.
Number 7. Constipation, the digestive side effect of amlodipine you shouldn't ignore. Constipation is often seen as a minor inconvenience, but when it's caused by medication like amlodipine, it can quickly escalate into a serious health concern, especially for older adults. The underlying issue lies in how amlodipine works. As a calcium channel blocker, it relaxes smooth muscle, not just in blood vessels, but also in the walls of the intestines. This slows down the natural muscular contractions, or peristalsis, that move waste through the digestive tract. As a result, stool spends more time in the colon, where water is reabsorbed, leading to dry, hard stools that are difficult to pass. Patients may experience straining during bowel movements, persistent bloating, a feeling of incomplete evacuation, and reduced bowel movement frequency, sometimes going days without relief. These symptoms may seem mild at first, but they can compound over time, affecting daily comfort, appetite, and overall well-being. The risks go beyond discomfort. Chronic constipation from amlodipine can cause hemorrhoids, anal fissures, and even fecal impaction, which may require medical intervention. In the elderly, urinary tract infections, UTIs, become more likely due to pressure on the bladder and incomplete emptying. These complications can significantly affect quality of life and increase the risk of hospitalization, particularly in older adults, those with limited mobility, or individuals taking multiple medications with similar side effects. If you're taking amlodipine and notice a change in your bowel habits, don't dismiss it. Talk to your doctor about fiber intake, hydration, stool softeners, or possibly switching to a different medication. Constipation may seem like a minor issue, but when it's drug-induced and persistent, it's a warning sign your body needs attention. Your digestive system speaks quietly, but its message is important. Listen. Number 8. Peripheral edema, the most common yet overlooked side effect of amlodipine. If you've noticed your shoes fitting tighter, sock marks lingering on your ankles, or a subtle puffiness in your feet by the end of the day, don't ignore it. These are classic signs of peripheral edema, the most frequent side effect associated with amlodipine, and they may be signaling something serious. Peripheral edema occurs when amlodipine, a calcium channel blocker, dilates blood vessels to lower blood pressure. While this action reduces cardiovascular strain, it also allows fluid to leak from the blood vessels into surrounding tissues, especially in the lower extremities where gravity plays a role. The result is visible swelling, most often in the feet, ankles, and lower legs. This isn't rare. Studies show that 10 to 15% of amlodipine users develop peripheral edema, and the risk increases significantly at higher doses, particularly 10 milligrams daily. Women are especially vulnerable, and symptoms typically appear gradually over days to weeks after starting or increasing the dose. The swelling may be painless, but it can still cause discomfort, heaviness, and difficulty walking or wearing regular shoes. Many patients dismiss it as weight gain, aging, or heat-related swelling, but in reality, it's a vascular red flag, a sign that your circulatory system is under strain. What makes this concerning is how easily it's overlooked or misattributed, even by healthcare providers. Yet, untreated peripheral edema can lead to venous insufficiency, skin breakdown, and increased cardiovascular burden over time. If you notice persistent swelling after beginning amlodipine, document your symptoms and consult your doctor. Dose adjustment, combination therapy, or switching to a different medication may help alleviate the issue. Swelling may seem harmless, but when it comes to your heart and circulation, no symptom is too small to take seriously. Number 9. Angioedema, the silent, life-threatening side effect of amlodipine. Among the most dangerous yet underestimated side effects of amlodipine is angioedema, a rare but potentially fatal allergic reaction that causes rapid swelling of deep tissue, especially in the face, lips, tongue, and throat. Unlike surface-level allergic reactions like hives, angioedema affects the deeper layers of skin and mucous membranes, making it far more dangerous. The swelling may begin with a tingling or burning sensation, followed by sudden puffiness, often asymmetrical and firm to the touch. In severe cases, it progresses to difficulty speaking, swallowing, or breathing as the airway begins to close. What makes angioedema particularly frightening is its unpredictability. It can occur within hours of starting amlodipine or even after months or years of safe use. This delayed onset often leads patients and providers to miss the connection between the symptoms and the medication. This condition is considered a true medical emergency. If the airway becomes blocked, it can lead to respiratory failure and death within minutes. Immediate treatment with antihistamines, corticosteroids, and epinephrine is often necessary. In critical cases, intubation or a tracheostomy may be required to secure the airway. The mechanism behind amlodipine-induced angioedema involves inflammatory mediators like histamine and bradykinin, which increase vascular permeability and allow fluid to accumulate in the tissues. This reaction may be immune-mediated or non-allergic, making it even more complex to predict. If you or someone you know develops facial swelling or throat swelling, hoarseness, or difficulty breathing while taking amlodipine, call emergency services immediately. Time is critical. Never dismiss facial swelling as a minor reaction. When it comes to angioedema, every second counts.
Number 10. Hepatotoxicity, the rare but devastating liver side effect of amlodipine. Amlodipine is trusted by millions to manage high blood pressure, but in rare cases, it can pose a serious threat to one of your most vital organs, the liver. This condition, known as hepatotoxicity, refers to drug-induced liver damage and can escalate quickly if not detected in time. The liver is responsible for metabolizing amlodipine. In rare individuals, the drug's metabolite byproducts form reactive compounds that injure liver cells. The damage may begin silently, but as it progresses, patients often experience profound fatigue, nausea, abdominal discomfort, and loss of appetite. Alarming signs like yellowing of the eyes or skin, jaundice, and dark-colored urine indicate significant liver dysfunction. Lab tests will typically show dramatic elevations in liver enzymes, particularly ALT, alanine transaminase, and AST, aspartate transaminase, often 10 times the normal limit. These values signal active liver cell injury and require immediate medical attention. In one documented case, a patient began experiencing jaundice, abdominal pain, and vomiting just 1 week after starting amlodipine. Blood tests confirmed severe liver enzyme elevation and bilirubin buildup. The drug was stopped immediately, but the recovery took months and some liver function remained permanently impaired. Though rare, amlodipine-induced hepatotoxicity can progress to acute liver failure, a life-threatening emergency that may require hospitalization, intensive care, or even liver transplantation. The danger lies in the delayed recognition. Liver damage doesn't always cause pain in early stages, and symptoms are often mistaken for a stomach virus or fatigue from aging. If you're taking amlodipine and notice symptoms like persistent nausea, yellowing skin, dark urine, or unusual fatigue, request liver function tests immediately. Early detection is the key to preventing irreversible damage. Your liver may be silent, but when it speaks, it's always serious. Listen carefully. Number 11, peripheral neuropathy. Amlodipine's silent attack on your nerves. Amlodipine may be effective at controlling high blood pressure, but in some patients, it comes with a hidden cost: peripheral neuropathy, a progressive condition that damages the nerves outside the brain and spinal cord. While rare, this side effect can be debilitating and is often overlooked until serious damage has already occurred. The symptoms begin subtly: a tingling sensation, mild numbness, or a strange burning feeling in the fingers or toes. Over time, these sensations intensify, spreading through the hands, feet, or legs. Patients describe the pain as stabbing, electric, or fiery, often worsening at night. As the condition progresses, it can interfere with fine motor skills, making it difficult to button clothes, grasp utensils, or walk without assistance. Balance becomes unstable, especially in low light conditions or uneven terrain, increasing the risk of dangerous falls. Even after discontinuing amlodipine, nerve recovery may be slow or incomplete because the drug's mechanism may interfere directly with calcium signaling in nerve cells, which is essential for proper nerve function and communication. By blocking calcium channels, amlodipine may inadvertently disrupt normal nerve transmission and trigger degeneration of peripheral nerve fibers. Unfortunately, peripheral neuropathy is often misdiagnosed as a symptom of aging, diabetes, or vitamin deficiency. This leads to delayed intervention and prolonged suffering. If you begin to notice tingling, numbness, burning, or loss of coordination while taking amlodipine, don't ignore it. These are not just minor annoyances. They are warning signs of potential nerve damage. Talk to your doctor immediately about your symptoms and consider a neurological evaluation. Early recognition and prompt action can prevent permanent impairment. Your nervous system is the foundation of every movement and sensation. Protect it before the damage becomes irreversible.
Number 12. Extrapyramidal symptoms, a rare but alarming neurological side effect of amlodipine. While amlodipine is primarily known for managing blood pressure, in rare cases it may cause extrapyramidal symptoms, EPS, a group of involuntary movement disorders more commonly linked to psychiatric medications. When they occur in patients taking amlodipine, they often go unrecognized and misdiagnosed, leading to serious and unnecessary suffering. Extrapyramidal symptoms originate from disruption in the brain's motor control pathways, particularly those influenced by dopamine. Though rare, calcium channel blockers like amlodipine may interfere with these neural circuits, leading to tremors, muscle stiffness, and abnormal movements. Patients may experience neck twisting, cervical dystonia, facial spasms, involuntary eye rolling, oculogyric crisis, or limb posturing, tremors at rest, rigid or robotic-like movements, and muscle contractions that cause twisting or repetitive motions are also common signs. In more severe cases, speech becomes slurred, swallowing is difficult, and walking is impaired, mimicking conditions like Parkinson's disease or dystonia. These symptoms are not only physically disabling, they also carry a heavy social and emotional toll. Patients often withdraw due to embarrassment, fear, or misunderstanding from others. Unfortunately, these side effects are frequently misattributed to aging, anxiety, or unrelated neurological disorders. This can lead to additional medications being prescribed unnecessarily, further complicating the clinical picture. Extrapyramidal symptoms caused by amlodipine is rare, but it's important to recognize it early. Symptoms can sometimes improve after discontinuing the medication, but in some cases they may persist or require neurological intervention. If you or a loved one is taking amlodipine and begins to exhibit unexplained muscle spasms, tremors, or changes in movement or speech, don't wait.
Seek medical advice immediately and request a full neurological evaluation. When it comes to brain and motor function, no unusual symptoms should ever be ignored. What to do if you experience these? If you're experiencing any of the side effects mentioned in this video, whether it's swelling, numbness, mood changes, or digestive issues, do not stop amlodipine abruptly. Suddenly discontinuing this medication can cause a dangerous spike in blood pressure, increasing your risk of heart attack or stroke. Instead, track your symptoms carefully. Keep a daily journal noting the type, timing, and severity of any unusual reactions. This record will help your doctor determine whether amlodipine is the cause and guide safe next steps. Speak with your healthcare provider. Ask whether an alternative treatment like an ACE inhibitor or ARB might be appropriate for you. Your doctor may also recommend lab tests such as liver function panels, electrolyte levels, or an ECG to rule out serious complications. Remember, amlodipine can be life-saving for many, but when side effects occur, early recognition can make all the difference. Your health deserves clarity, not confusion. Don't let strange symptoms go unaddressed. Which side effects surprised you the most? Comment below and share your experience. Subscribe for more in-depth, science-backed health guides, and share this video with someone you care about. It could protect their life.